Talking menopause next. Some women who use hormone replacement therapy to ease the symptoms find themselves experiencing a second menopause while trying to come off it. The withdrawal causes hot flushes, brain fog, hair thinning, just like the change is trying to prevent. Well, let's speak now to Dr. Shirin, a menopause expert and intimate health expert. Look, this is awful, isn't it? Lots of people think that HRT should solve the problems, not just delay them.
I think what we need to start doing is looking at menopause as a hormone deficiency. What tends to happen is people think that the change is a one-off event, whereas it's a process that women go through. And HRT is fantastic in relieving the symptoms of menopause. But people need to be aware that if they decide to stop HRT, there is a chance that the symptoms will occur at the time of stopping the hormones. Because just like during the menopause, coming off HRT is removing the hormones that women depend on. The thing I'd like to ask is, why are we stopping HRT now? There is enough evidence to show the benefits of HRT in women post-menopause, not just in relieving the symptoms such as hot flushes, but also improving neurological symptoms, improving the heart health of women in general, improving their bone health. And the advice to come off HRT after 5 to 10 years is outdated. So we need to look at why these women are actually trying to come off their HRT.
So for many women, then, you think that HRT should be a permanent medical treatment that they undergo from whatever it might be, late 40s until perhaps their death?
Absolutely. And there is no reason why it shouldn't be now, because if you look at any other hormone deficiency, if you look at diabetes, for example, or hypothyroidism, you don't suddenly stop the hormones after an arbitrary period of time. You continue them for as long as the person needs them, and often that is until their death. So why should replacing estrogen, progesterone, testosterone be any different?
What about those people that come off HRT because they may have a history of breast cancer within their family, or somebody within their family is diagnosed with it? There are those links that make people worry, aren't there? There could be good reasons, is what I'm trying to say, for coming off HRT. Are those people then just expected to experience this second menopause? That's just part of the package of coming off HRT?
Well, firstly, I'd like to say that the fear of breast cancer is no longer a reason to come off HRT. You need to look at every personal situation and assess what is best for the woman. The body-identical, more natural, newer forms of HRT, which are available on the NHS as well, have been shown to have less of a link with the side effects that we traditionally associate with HRT. So in the first instance, any woman who has a problem and is on conventional HRT should look at changing it. The other thing I say is, if you are going to come off HRT for whatever reason, and that should be something that the woman and her doctor should discuss, then rather than stopping it abruptly, you can come off gradually to minimise the symptoms you get from the withdrawal.
Does every single woman go through quite extreme symptoms when they hit menopause, or can some women go through it with relatively minor side effects and therefore may decide that HRT simply isn't for them? Are they the lucky few, or does that not really happen at all?
No, of course there are women that will go through menopause and not feel a thing. Everyone's different, and there is a spectrum of what people experience when they go through menopause. But just to say, with HRT, it's not just about the benefits of stopping the flushes and the brain fog. You also get the additional benefits of reducing osteoporosis, reducing cardiovascular disease, and reducing problems with memory and dementia as well, which have been proven to be beneficial effects of continuing with hormone replacement. I think the thing to appreciate now is we used to die a lot earlier. So menopause was a short-term state, whereas now women will spend a third of their lives post-menopausal. So it is important to assess that, as well as just the benefits in stopping hot flushes.
Yeah, and it's so important, isn't it, to break the taboo. It is still a taboo to talk about the menopause. Very often it's an uncomfortable conversation. It's embarrassing, frankly, especially around men, to be talking about menstruation or the pause of menstruation at all. Are we doing better at addressing this? Because it needs to be out in the open. People need to understand what to expect for a third of their life.
Yeah, absolutely. And I think we are getting better. We're not there yet, but there are steps being taken to improve the situation for women. There is a bill going through Parliament to make HRT free for women in England at the moment. I think that's great. I think we underestimate men as well. With education, most men understand that women go through the menopause. They're not completely immune to that. And a lot of men want to understand what their partners are going through, what their friends are going through, and they can be quite understanding, but it is a question of, like you said, breaking the taboos, educating the public as well as medical professionals as to what the latest guidance is.
And just lastly, you mentioned that there are some milder forms of HRT. What's your view on some of the alternatives? Are there any kind of good herbal alternatives that you would recommend, or are you very much in the HRT camp?
In terms of HRT, I would recommend what works for the women. I believe in replacing the hormones that are missing. And while you do get some supplements that can help improve symptoms for women, they don't go all the way in providing all the health benefits. But it needs to be an individual choice. It needs to be one made through education, not fear. And I think it's really important that we continue the discussion.
OK, Dr. Shirin Lakhani, it doesn't have to be an unfortunate and unpleasant period in our lives by the sounds of things. Really good to talk to you this morning. Thank you.
Thank you for having me on.